I think people forget this, but honestly, in the late 1940s, there was an increase in polio outbreaks, and outbreaks of polio disabled over 35,000 people in the United States every year. The CDC reports that, parents, mothers, and fathers were afraid to send their kids out to play. They were afraid to send their kids out. There were quarantines actually back in that time. There were travel restrictions even. And this is the thing, once the vaccine came into play, those cases went down. But can you imagine a time where people were literally fearful on a day-to-day basis? I mean, that's what we're talking about when we talk about polio, at least how things used to be. Polio is very, very contagious. We're going to talk about how contagious it is, how you get polio, also, what the symptoms are. And you really might be surprised by the symptoms and sometimes lack of symptoms that there are. Guys, I'm Dr. Jen. It's good to see you, practicing family physician, on-air health expert. Now, first of all, you should know polio has actually been around since the ancient days, like since ancient times. Isn't that fascinating? It's been around a long time. This is not a new disease. And by the way, polio is caused by the polio virus, just like many other things that we have seen more recently and before. This is a condition that's caused by a virus, but it's been around since ancient times. And I said how literally in the 1940s, there were parents afraid to send their kids out to play. By the way, guys, for those of you who are watching this video, and I asked this on Facebook recently, how many of you remember the time before the polio vaccine came out? How many of you remember that time? What was it like? Write in the comments. Tell us what it was like and what the sentiment was. The thing about it, as I mentioned, is it's very, very contagious. It is spread from person to person. And the thing about it is that most people who actually get infected with polio will not have visible symptoms, which makes it even that much more complicated. If most people don't know they have symptoms, then it can spread unchecked because people won't necessarily know that they have it. And the thing about it is, we know that polio, the polio virus, in people who have polio, who are infected, it actually lives in the throat and the intestines of those people who are infected. So the way that it spreads predominantly from person to person is through, yes, droplets from coughs and sneezes, but that's not even the most prominent route. It's through fecal matter coming in contact with feces. Now, I know you guys are like, ew, gross. How, they would know. No, this is the thing. Fecal matter sometimes is literally everywhere. If somebody goes to the bathroom, doesn't wash their hands, or touches something before they wash their hands, I mean, and it's not necessarily visible. So no, you're not always going to know that you've come in contact with fecal matter because it can contaminate a number of things if someone's touched things before washing their hands. All right, so let's talk about the symptoms. All right, so this is really important. As I mentioned, most people who get infected with polio will not have visible symptoms. This is the thing about it that makes me scared. Then you sort of move up this sort of symptom tree. 1 out of 4 people will have flu-like symptoms. But flu-like symptoms could be so many things, right? I mean, as a family doctor, I'm kind of like, if somebody came into my office with, okay, listen to these symptoms: sore throat, fever, fatigue, nausea, headache, stomach pain. I mean, it could be a number of things. But 1 in 4 people who have polio have those symptoms, which can literally mimic a number of other conditions. And not only that, those symptoms in those people with polio who get these symptoms, their symptoms will last 2 to 5 days and then will go away. But they have polio. And remember, most people will not have visible symptoms at all. Now let's go to an even smaller portion of people who get polio. A very small portion of people who get polio will get the most serious of symptoms. Symptoms that affect the brain and the spinal cord. That's things like numbness and tingling. That's things like meningitis, which is an infection of the brain and spinal cord, or even paralysis, becoming paralyzed. Of course, this is like the thing that is most feared because it can actually lead to death and permanent disability. I have patients who have got polio as a child and have problems with their limbs, have problems walking, etc., because of paralysis or partial paralysis, things like that. And this is the other thing too. Keep in mind there is something called post-polio syndrome. For example, kids who seem to have recovered from polio when they were a child, they can actually develop new muscle pain, weakness, paralysis as an adult, and that is called post-polio syndrome. Guys, the idea here is that this is a complex disease, one that is dangerous and highly contagious. The good thing is, well, first of all, the bad thing is there is no cure, if you're wondering. There is not a cure, but there is a vaccine. And that's what's really, really important, okay? We actually have two vaccines. One is an injection, the other is an oral vaccine that's typically used throughout the world. Guys, this is the idea. This video, and I wanted to talk about this because polio is something that we don't always think about, but we should never forget, and we should make sure we take it seriously. This is one of the reasons, one of the many reasons why vaccinations could not be more important. One of the reasons why we have been blessed more recently to not have to think about polio the way folks in the 40s and 50s had to probably think about it is because we have a vaccine. What's important is that we use that vaccine, we get our kids vaccinated, that we make sure that we get our full vaccination so we are protected, that we protect ourselves and we protect other people. Guys, I will come up with more information on polio. I just wanted to sort of give you this little primer. I think it's really important. Let me know. Let me know if you've had polio. Let me know if you remember getting the polio vaccine. Let me know if you remember the time before the polio vaccine. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. If you're on Facebook, please like and follow my page. Thank you in advance for the stars that you send, and consider joining my subscription groups. If you're on YouTube, please subscribe to my channel and click the little bell for updates for both of you guys. And for any of you who are watching, please go to my website at drjencaudle.com to sign up for my free health newsletter and see what other things we got. All right, guys, talk to you soon.